Welcome to the deep dive. Today we're tackling inflammatory bowel disease, or IBD.
That's right.
We've got the key info you need, boiled down. Our mission is basically a clear, high-yield overview for effective revision fast.
Exactly. Think of it as your rapid refresh on IBD essentials.
Okay, let's jump in. So, IBD.
Yeah.
What is it, fundamentally?
Fundamentally, IBD covers chronic inflammatory conditions of the GI tract. We're mainly talking Crohn's disease and ulcerative colitis.
Got it.
The core issue is this ongoing inflammation that causes damage to the digestive system.
Okay, inflammation and damage. What actually causes this inflammation, the etiology?
Well, the honest answer is we don't know the exact cause. It seems to be a kind of complex interplay between genetic susceptibility, environmental triggers, and crucially, the immune system. It looks like an abnormal immune response to normal gut bacteria.
An abnormal immune response. Okay,
That's
so
right.
who's more likely to get it? What are the risk factors we should know?
Yes. For revision, the mnemonic FGUNU can be useful.
FGUNU.
Yeah. Family history, certain genetic factors, NSAID use, that's non-steroidal anti-inflammatories,
Right.
urban living, and smoking. Smoking is interesting. It increases risk for Crohn's, but might be protective for UC, though we don't recommend smoking, obviously.
Okay, FGUNU. Good tip. So, biologically speaking, what's the mechanism? The pathophysiology.
So basically, the immune system gets it wrong. It mistakenly targets the gut lining.
Right.
This leads to persistent chronic inflammation. Normally, there's a balance, tolerance, between the immune system and gut microbes. In IBD, that tolerance is lost.
The defense system turns inward. Now, if someone presents with chronic diarrhea, pain, what else needs to be on the list? The differential diagnosis.
Good question. You absolutely need to consider other possibilities, things like infectious colitis, celiac disease, which is gluten-related, irritable bowel syndrome, IBS, that's common, and especially in older individuals or with red flags, colorectal cancer.
Definitely need to rule those out. How common is IBD in the UK? Epidemiology.
The estimate is around 1 in 250 people. So fairly common.
Yeah.
It affects both men and women pretty equally.
Yeah.
And the peak age for diagnosis is often in the teens and 20s, so it tends to affect younger people.
Young adults mainly. What are the classic signs and symptoms? Clinical features.
Common things you'll see are abdominal pain, diarrhea, which can often be bloody, especially in UC weight loss, fatigue, and sometimes anemia.
And differentiating Crohn's and UC.
Right, so Crohn's can affect any part of the GI tract, mouth to anus, often in patches. Think pain, diarrhea, weight loss, fatigue. Ulcerative colitis, or UC, is generally limited to the colon and rectum, and it's continuous inflammation.
Okay.
So with UC, bloody diarrhea and rectal bleeding are really prominent features, along with the pain, weight loss, fatigue.
And you mentioned issues outside the gut, too.
Yes, exactly. Extraintestinal manifestations, things like joint pain, specific skin rashes, eye problems. And importantly, the disease course often fluctuates periods of flare-ups and then remission.
That sounds tough to manage. So how do you actually pin down the diagnosis? What investigations are done?
It's a multi-step process. Starts with taking a good history, understanding the symptoms, then a physical exam.
Standard stuff.
Then blood tests are key, looking for inflammation markers like CRP, checking for anemia, nutritional deficiencies, liver function. Stool tests are also vital. Ruling out infections, checking for blood, specific markers of gut inflammation like fecal calprotectin, and looking for pathogens.
Makes sense.
Then you move to imaging. Endoscopy, like a colonoscopy, lets you see the lining directly. CT scans, MRIs can show inflammation deeper in the bowel wall or complications. And crucially, biopsies, exactly. Taking tissue samples during endoscopy is essential to confirm the diagnosis under the microscope and assess the type and severity of inflammation.
A thorough workup. Once you have the diagnosis, what's the plan? Management.
The goals are really to control that inflammation, relieve the symptoms, and importantly, improve the patient's quality of life.
And the tools for that.
We use anti-inflammatory drugs like mesalazine, often first line in mild UC. Then immunosuppressants like azathioprine or methotrexate to sort of dampen down that overactive immune response.
Oh, okay.
And then there are the biologics-targeted therapies, often antibodies against specific inflammatory proteins like TNF-alpha. Lifestyle factors like diet and stress management can play a role too.
And surgery.
Surgery is generally kept for severe cases or when there are complications like blockages or fistulas that don't respond to medication.
Right. So looking ahead, what's the long-term picture? Prognosis and complications.
The prognosis really varies quite a bit depending on the type, severity, and response to treatment. Potential complications include strictures, that's narrowing of the bowel, fistulas, which are abnormal tunnels connecting different parts of the bowel or other organs, and nutritional deficiencies because of malabsorption.
And cancer risk.
Yes, there's an increased risk of colorectal cancer over the long term, particularly with extensive colitis, which is why regular surveillance colonoscopies are important. And don't forget, those extraintestinal issues can persist or recur.
Okay, quite a lot to consider there. So to wrap up the main points, IBD, chronic inflammation in the gut, Crohn's and UC, the main types, needs a really comprehensive approach for diagnosis and ongoing management.
Absolutely. It really highlights how complex gut health and the immune system are.
And for anyone wanting to dive deeper or prep for exams, definitely check out passthemsra.com and freemsra.com for more resources.
Great resources. And just a final thought to leave you with. Considering how complex the immune system is and how it goes awry in IBD, what future breakthroughs perhaps in understanding the microbiome or immune tolerance might truly revolutionize how we treat these conditions? Something to think about.